Hello everyone, this is Dr. Khan. I have another pleasant, wonderful patient. She is 5 weeks and 4 days out from her surgery, and around the 6 week mark. We want to hear from her. Again, I'm so grateful to all my patients, including you, for coming forth and discussing, because I feel from the many feedbacks that I get, this is what other patients find very motivating. And especially when you said you were afraid of doing the surgery, I totally understand. I myself am afraid of the surgery whenever I have gotten one, because it is not a pleasant experience, in the sense that no one looks forward to surgery. But please go ahead and share what you meant by you were afraid, what it means to you and how you interpreted it.
I think that anytime that you're having a surgery, there's the fear of the unknown. Then there's also that fear of you're out of control of yourself, and you're in somebody else's hands. That's a huge fear. I think the fact that we're not intubated and that Dr. Khan uses the Twilight is a huge plus. But I still didn't know what to expect with that, and I don't think anybody knows what to expect with it. So the support that the ladies, show on our group page is real, and that fear is still there. But trust me when I say, I swear to God, no one was more afraid than me. I even wrote a little thing about it, reference into Forrest Gump, and I should have ran. And I wanted to run, and I actually took a whole year to get me here. And I actually canceled once. We had a surgery planned, and I canceled, and then I stuck to my guns this time. But going back to the fear of the surgery itself, it really is the fear of the unknown. Even though I talked to numerous women, I still had that fear of the unknown and someone else being in control of me, my breathing and all of that. And then once I realized that you're not being intubated with the tube, you're in this deep state of just twilight sleep. Lord knows that if you get your videos from Dr. Khan, there's a lot of snoring going on from many women. I haven't seen mine yet. I'm sure I was probably right up there with the top 3 best snorers, but it's just that fear. And trust me when I say you don't have to have that fear anymore. I was scared to death, and
it's a very normal feeling to have. There's a lot of anxiety, plus obviously knowing that the surgery, what you're going to look like afterwards. And but again, it's a very healthy thing, and I'll tell you, almost all my patients are excited about proceeding, because what's going to be at the other side, and it's only going to be good health, because this is what you call essential surgery. Now, you remember anything from your anesthesia?
Nothing.
Yeah.
No, I remember waking up and I was like alert and awake, and first thing I think I said is, I have to go to the bathroom.
Okay. All right. Okay. Now that's very healthy and good. We don't put a Foley catheter in. That's very important. No unnecessary tubes. So this is, we want to go kind of the natural way. Less is more. The next question: what symptoms, now 6 weeks out, almost 6 weeks, how do you feel overall? What symptoms have you sought relief from?
I don't have my daily headaches at all anymore. I had super bad plantar fasciitis. I still have a little bit of that, but not as bad at all. I can sit in we have a high top table in our kitchen with the high chairs. And when I used to sit at the table and I'd go to get down, it took me a good minute. I'd have to stand there before I could actually walk. Now I just get down and walk. My joints aren't hurting as bad. My hair's not falling out. My complexion's clearing up, and I'm 59, I'll be 60 next month. So to have acne, adult acne, is kind of embarrassing at my age, but I haven't had any of that. I feel great. I feel really good.
No, thank you very much for sharing. And anything else you want to tell the patients? I like the fact you did your homework, talk to the patients. This is very important. Your best source for any surgery that you're going to get is to talk to the patients, other patients who have gone through the process, because you know what you're going to be going through. So it kind of helps with the anxiety. Right. So sorry, you were saying?
That is true. I was totally prepared, and I have to thank the girls of the group for sure for sharing the things that help you get prepared, as to the binders, the bras, the mastectomy pillows, I use that. The wedges that you use to sleep on. I mean, every little bit that you can prepare yourself before, physically and mentally, is just a plus. What I want to say is, so many women we cared so much about what we look like in the first place to get these things done, and now taking them out, there's that anxiety of what you're going to look like after. And there just comes a time in life when you realize that beauty really isn't on the outside, it's what's inside.
Very well said. Yeah.
We look at everyone and say, wow, that person's really a good looking person, but they might not be so pretty on the inside. And I really think that we just need to be a little bit lighter and easier on ourselves as women, and just we got to take back our health. And if that means taking these poisonous bags out of our body, then that's what we have to do. We need to take back our health, and thanks to Dr. Khan and his staff, for believing in us, because not many out there do believe in it. So I just think it's just one day at a time, and if you're not getting these things, these illnesses taken care of, and these symptoms, then this may be your only choice. Try it, and trust in us and in Dr. Khan and his skills that it really is,
You did not need drains. I've not placed drains like you've heard this whole year.
No, that was another concern.
Yeah. And then I will tell you the surgery needs to be done pristinely in a very sophisticated, defined, religious way, such that there's no toxins left behind. And this is what basically ultimately relieves the patient of all the symptoms of what is BI. And hopefully as time progresses, when you start exercising, you're going to go swimming, gentle yoga, and all those exercises that we talked about, that's going to help with the upper extremity strength, shoulder strength, that will only add to your enhanced health and activity, and the neck and back pain and everything else.
Yes.
All right. No, God bless you. Thank you.
Thank you.
You're welcome. Bye-bye.